Welcome back to Health Bulletin. We've got some important health updates from India that you really don't want to miss. Let's start in India's northeastern state of Mizoram, where the HIV crisis is reaching alarming proportions. Mizoram now reports an HIV prevalence rate of 2.73%, which is significantly higher than the national average of 0.2%. Health ministers are calling for immediate action. The data shows that about 67% of new HIV infections here stem from unprotected sexual activity, while 44% are linked to unsterilized syringes. On a positive note, there have been some improvements. New infections and HIV-related deaths are beginning to decline, thanks to better awareness campaigns and improved healthcare facilities and wider availability of antiretroviral therapy. The rising number of HIV cases in India is a serious challenge that demands ongoing attention and a collective effort from all stakeholders. This isn't just a health issue, it's a social and economic concern that affects millions of lives, families, and communities. Shifting focus to another critical issue, dog bites and human rabies cases are seeing a worrying trend across India, with the state of Karnataka particularly hard hit, raising concern amongst both health officials and communities. Stray dogs, which are a common sight in many towns and cities, are often at the center of this issue. While not all stray dogs are aggressive, the growing number of bites has raised alarms, especially with rabies being a fatal disease if not treated promptly. In 2024 alone, over 361,000 dog bite cases and 42 human deaths were reported, and early 2025 figures are already showing a worrying increase. Rabies, a nearly 100% fatal vaccine-preventable disease, once symptoms appear, spreads primarily through bites, with dogs being responsible for 99% of cases. The World Health Organization emphasizes that key components of a successful control program include robust surveillance, mass dog vaccination, and public education. And this serves as a crucial reminder of how essential it is to vaccinate our pets and raise awareness about this dangerous disease. Now, let's move to the latest concern in India, a sudden and sharp spike in swine flu cases, especially in Delhi. Hospitals across several states are seeing an influx of patients suffering from severe flu-like symptoms, including high fever, cough, sore throat, and respiratory distress. Health experts warn that if precautions aren't taken quickly, this surge could escalate even further in the coming weeks. With the recent rise in cases, it's more important than ever to stay informed and take preventive measures. Now, new recent reports from India reveal that over 80% of IT workers are dealing with fatty liver disease, and a staggering 70% are classified as obese. Now, this isn't just another statistics, it's a wake-up call for the tech industry. You see, fatty liver occurs when more than 5% of fat builds up in the liver, and if left unchecked, it can lead to severe conditions like cirrhosis and even liver cancer, sometimes requiring a transplant. This study also uncovered that 71% of IT employees surveyed are obese, and about 34% suffer from metabolic syndrome, a cluster of conditions including obesity, diabetes, and high blood pressure. This is more than just numbers on a page. It's a stark reminder that the demanding tech lifestyle, with long hours, stress, and little time for self-care, is taking a serious toll on health. While many companies have introduced wellness programs, the study highlights that these efforts need to be matched with active participation by employees. Regular health checkups, proper screening for fatty liver, and, importantly, a better work-life balance could make all the difference. It's crucial for both employers and employees in the tech sector to take these findings seriously and act now. The health of our workforce is at stake, and we can't afford to be complacent. From Mizoram's mounting HIV crisis and the persistent challenge of rabies in India to the recent surge in swine flu cases, these highlight the urgency of proactive public health measures. These are not isolated issues, they are interconnected challenges that require our attention and action. Here at Health Bulletin, We're committed to keeping you updated with the latest on these critical health topics. Thanks for watching, and if you found this roundup informative, please like, share, and subscribe for more updates.